So it's a project we started when I was in Paris. So we try looking at biological biomarker or clinical biomarkers that you may assess when the patient is entering intensive care units and can be able to predict long-term or short-term outcomes. And what we found initially is when you combine clinical data and biological data, you may get better results to predict outcomes at short and long term. So it works both for evaluating the mortality at discharge or the worse outcome at discharge, like functional disabilities. But we also found that utilizing biological data can be helpful to predict the chance of recovery after discharge. And we are pursuing this project. Now we are also interested about like immunology. We did not look at previously. And so I think currently we know some biomarkers are able to reflect the neuronal loss, are able to reflect the neuronal injury. Based on those criteria, these biomarkers are interesting to assess like long-term outcome. Because if you have neuronal loss, you may have brain atrophy, so you can have cognitive disorders. Concerning like what is particularly interesting for NORSE is the development of a post-NORSE epilepsy for patients who didn't have any seizure previously. It's quite difficult currently to identify some biomarkers. And we have two main hypotheses, but currently there is no one that is predominant. But two main hypotheses is that the post-NORSE epilepsy is only a consequence of the status epilepticus. So during status epilepticus, the brain is damaged. And as a consequence, in the following month or the following weeks, patient may present some recurrence of seizures. But the second hypothesis could be that for reasons that currently unknown, patient can have a reactivation of this immune dysregulation after several months, and that can result in seizure recurrence. So currently, we don't know really what can trigger this seizure persistence in something where we need to investigate further.